Okay, a very good day to Dr. Maria. Today I would like to present about the breast cancer. Okay, breast cancer is a disease in which cells in the breast grow out of control. From this global statistic, we can see that breast is one of the most common cancer leads to death. And mammogram is one of the most suitable imaging technique used to detect the breast cancer. And these are the basic components of the mammogram. And how does it work? Okay, first of all, the generator will generate high X-ray electrons from cathode to anode. And anode is made of molybdenum or rhodium, which will produce the low energy X-ray beam to the breast. And then the receptors of the screen films will receive the signals from the breast and send it to the digital image processing device. And after the image is being processed, it will send to computer and display on the film. And these are the important parameters used to control the radiation exposure. And how's the procedure? Okay, first of all, the technicians will make sure the patients wear deodorant, perfume, and necklace before starting the test because it will appear as white spot on the film letter. And then the patient is asked to stand and put a breast on the plate, and the breast is firmly pressed. Compression pressure is set between 10 to 20 newtons. It really depends on the size of the breast. And then the plate flatten and keep it still for a few seconds. And the woman will get two X-ray image for each breast. One is the top view and another one is side view. And then the result is interpreted by radiologists. And radiologists will analyze whether she has cancer or not by looking at the classifications of the film. Okay, this is the different types of patients, conditions, and precautions taken. First, the woman with a family history of breast cancer. Usually, breast exam every 6 months will be taken, starting from the age of 25 to age 40, possibly alternating between a breast MRI and a mammogram, because a mammogram is an X-ray test will have the radiations. And for pregnant women, lead shield is placed over the lower part of the belly to help keep radiations from reaching the womb. And for women with breast implant, 4 extra features called implant displacement fields will be taken by pushing the implant and pull out the breast tissues to be compressed. And these are the weakness of mammogram and some of the suggestions to improve. First of all, is pain and anxiety caused by the compressions of the breast. And patients should avoid scheduling the mammogram before or during the menstrual cycle because during that period they will feel much more painful. And if they really worry about the pain, they can take a dose of Advil about an hour before the mammogram. And second is the false positive mammogram. It means looks are normal even though no cancer is actually present. So the radiologist is suggested to use of computer-aided detections to improve image interpretations. And besides use of consensus double reading by 2 radiologists independently so that I can compare, discuss, and comes to a much more accurate conclusion. And the third one is the excessive exposure to radiations because mammogram is X-ray test. So the medical staff should enforce radiation safety guidelines such as strict training to radiologists, and patients should take precautions before and during the mammogram to minimize the radiation risk. And for cell reflections, I think research on breast cancer is very important for me to do work much more efficient and less time consuming. And I need to plan the workflow of the assignment so that it won't exceed the time limit and keep editing the contents. And the next one, I need to try myself to be much more critical thinking for decisions making so that I can take the most important information to present within the time period. Okay, comes to conclusions. Mammogram is the most common imaging modality to identify early non-invasive cancer and allow treatment before they become invasive. So I can say that mammogram is a good way to detect the breast cancer, but it can't prevent the breast cancer. Furthermore, overdiagnosis using a mammogram should be avoided to prevent radiation risk because it's an X-ray test. Okay, these are some of the references. I think that's all from me. Thank you.